Patient I'll be presenting today is a 30-year-old female to male transgender with a history of epilepsy, anxiety, major depressive disorder, and ADHD. Patient presents to UTMC and Patient Recovery Services with a complaint of opioid dependence with active withdrawal. The patient currently uses approximately 1 gram of fentanyl daily. She snorts that, and her last use was yesterday at looks like about 1 o'clock in the afternoon. She's been using, or they have been using, either heroin or fentanyl since they were about 15 years old. They do have one history of an intentional overdose, and that was over over this past summer, so the summer of 2023. As far as substance abuse treatment, the patient's been here 3 times in the last 12 months, and has had one other stay at Arrowhead. In regard to outpatient services, they tend to get set up with the services while they're inpatient and then not follow up afterward. But they did express some interest in a residential type facility following this stay. Current withdrawal symptoms include the hot and cold sweats, anxiety, restlessness, and the patient's utilizing the PRNs that are available via the unit protocol. Current COWS score is 7. As far as the patient's psych history goes, the patient was hospitalized following the intentional overdose last summer, but that's the only psych hospitalization. The patient currently doesn't have any outpatient psychiatry, and PCP is prescribing the psych meds that they're on right now. Patient currently denies any thoughts of harming themselves or anybody else. Patient currently denies auditory and visual hallucinations. As far as the patient's medical history goes, she does have epilepsy, and her last seizure was 1 month ago. It's currently being managed with Depakote. Home medications include Zoloft 100 for the depression, and also the anxiety, and Depakote 500 TID for epilepsy. The patient is currently also on Adderall for their ADHD, but we did not continue that for this stay. They're currently living with a friend, currently unemployed. Patient's eating, drinking, and sleeping okay, and reports cravings that are intermittent, and they rate them at about a 7 out of 10. As far as plan goes, we'll continue to manage withdrawal symptoms with the unit protocol PRN meds, and monitor them until they're ready to start Suboxone. That will likely be sometime either later tonight or tomorrow. As far as discharge planning goes, I know social work is looking for a residential treatment that would be suitable for this situation, and we'll kind of play it by ear until then. Thanks.